everyone. Good evening. So, we'll be discussing today the anatomy, the basics of anatomy. Well, for the very first year BDS students, the very word anatomy is a little scary word because it has a lot of branches, names, what you say, diagrams, what are arteries, what are veins, a lot of confusions are created. So first and foremost is the methodology part we have discussed in our previous section, how to study anatomy. So today I will be discussing few basic things like arteries. What are the role of arteries and how arteries functions and what are the arterial supply of various organs, some important organs we will be discussing. Then the venous or the venous supply and the nerve supply. And we will be also discussing some of the planes, that is anatomical planes. Because as a first year BDS student, it's always confusing what does anterior means, what does posterior means, what is superior, what is inferior. So today's session is basically for the very beginners. So if you think anatomy is tough, you are at the correct place. Let us see. I'll make sure all of you will fall in love with anatomy. So hello everyone, this is Dr. M.S. Balakrishna. I am Professor and Head of Department of OMFS, Maxillofacial Surgeon, and also the Academic Director of Edentu. Well, let's begin. So to begin with, let us begin with some anatomical terms, right? Because it is always confusing. What is anterior? What is posterior? This terminology is very important, right? Because this terminology is a universal terminology. If I say front of me or back of me, so that is a relative term. What is back of me may be front of someone else. So it is again a relative term. So that is why anatomical terms are very important to understand, and this will help in our dissections and even during the landmarks to find out what is anterior, what is posterior, what is superior, inferior. So it will help us to find landmarks and it will help us in future course of our dentistry. Okay, so let's begin. Now, my dear students, have you all played this puzzle? It's a very famous puzzles and all we all play in our childhood. And even if you go to some restaurants, you will find this for when the food is ordered and the food comes, you will be given a sheet of paper where you will have to play this. Now, if a person has to reach from one end to another end, then there are some directions they need to follow. And in these directions, when you follow, there will be obstacles. So you have to take a left turn, right turn, take a turn around, go. So basically, this landmarks what you will get, the pathway what you will get, there will be a correct pathway and a wrong pathway which will block it. So this left turn, right turn in our medical terms are also there. So to reach a particular position, it will help us to identify where the structures are there. So that is how this anatomical terms are there. So the other way, that way, this way. So it is always a confusion. And these anatomical terms are something like this. Whatever is in front of us, in front, is called anterior. Or you are seeing if this live class in your mobile phone, the phone is in front of you. So that is in front, so that is anterior. Anterior is also called ventral. So please understand that, do not get confused. Anterior is ventral. So ventral surface of a particular organ, if I tell means it is anterior. Then the posterior surface, back surface is called dorsal. So my back is wall. So that is dorsal surface, back side, dorsal. Above is the head. My head is there and above. So this is superior surface or superior it is called. So head is there on the topmost part of the body. So it is also called as cephalic. So head towards the head is called cephalic. And towards the feet is called caudal. Caudal. So anterior, posterior, superior, inferior. Anterior is called ventral, posterior is called dorsal, cephalic, inferior is called caudal. And then we have what? Right and left. So that is medial, lateral. Anything towards the midline of the body, this midline, nose is there. Anything towards the midline is called medial. And anything which is away, going away, that is called lateral. These are the very basic terminologies which most of you would be knowing it. Okay. Then you have got this midline of the body. You can see this, which is blinking on your screen. This is the midline of the body. So as I told you, whichever structure is towards this yellow line or midline of the body, that is called as medial, which is towards, and which is away is called lateral. So this photograph will tell you very clearly. So medial or towards the midline, M for M, you can remember like that. Midline, middle, or medial, all starts with M. Okay, and then the lateral is very easy to understand. Lateral is away from the body. Okay. Now, see, these are the some photographs of our film stars. Now you know all of them. I know that. Now, see this. Shah Rukh Khan is in the center part. There are 5 heroes here. So we'll take the central one. That is Shah Rukh Khan has the central part. Now, next to Shah Rukh Khan is your Amitabh Bachchan and Salman Khan. So both of them are medial. Understood? To Shah Rukh Khan. We are studying in respect of Shah Rukh Khan. So if Shah Rukh Khan is the reference point, medial to Shah Rukh Khan is Amitabh Bachchan and Salman Khan. And away, lateral are your Ranveer Singh and your Akshay Kumar. This is in reference to Shah Rukh Khan. Now, if I tell in reference to Salman Khan, medial is Shah Rukh Khan and lateral is Amitabh Bachchan. That is in reference to Salman Khan. See how it is changing. So the point of reference from there, it changes. Now, superior and inferior. This is very clear. So the point of reference, whatever it is above that is called superior, and whatever is below is called inferior. So superior is towards the cranium, above cranium, that is your skull, and inferior is towards your feet, that is your caudal surface. So please understand that superior is towards your caudal surface, superior is towards your cranium, and inferior, which is down, that is to your caudal surface. Same way, whatever is in front is called anterior, which we have already discussed. And anterior is called ventral also. Posterior is backside, and it is dorsal. So it's now in this person, if you see that midline, if this is there, if you put it all across the plane, we will be studying the coronal planes, sagittal planes, and all. So if this blue line is the reference point, what is that we will be discussing? Whatever is in front is all called anterior. It is in front. So the nose, mouth, all is anterior. And the back side is called posterior or dorsal surface. That is how you should remember. Next is proximal and distal. Proximal and distal. So proximal means towards the trunk or near the origin, or towards the origin, it is there is proximal. So if this is the reference point, proximal is this red one, towards the origin. Whereas distal is away from the origin. So proximal is towards and distal is away from the reference point. Again, the reference point may change, the proximal and distal things also will change. Now see this, you are seeing a burger. So this burger has got different layers. So now we have got this bun, what is there on the topmost layer. So that is the superficial part. So this is called superficial surface. And your tomatoes and cheese, which is in the deeper part. So it is the deep surface. So the bun is called superficial surface, and your cheese and all is in the deep part. So it is called deeper surface. Now, in relation to, if we think bun, we are talking. Now, suppose if take out the bun, this cabbage and all, take it out. The topmost layer is tomatoes. For example, topmost layer is tomato. Now, bottommost layer is bun. Here you have got cheese and the patty is there. So the superficial surface will be tomatoes now, and the deep will be the cheese and the patties and all. So this is how you should know superficial and deep relations. We'll be discussing that also. So these are what superficial is the outermost surface, and the deep one is the deep surfaces. So if you look like layer by layer, when you go and see, this is your lung, So that is on the superficially. When you take out the lung, you will get the deeper surface. Next terminology is ipsilateral and contralateral. Ipsilateral. Ipsi means same. Ipsi means same side. And contralateral means opposite side. Contralateral, opposite side. Okay. So ipsilateral means on the same side of the body. Now my left hand, this is my left hand, right? So on ipsilateral side of my left hand, my leg is paining. So that means my left leg is only paining, same side of the body. Contralateral side leg is paining means this is my left hand, contralateral. So my right leg will be paining that time. Ipsilateral, same side, contralateral, opposite side. So this were some of the terminologies. Now we'll discuss anatomical planes. Some planes are there. So you would have seen this skull, the overview of the skull. So you have got various sutures. You have got coronal suture, sagittal suture, right? Lambdoid sutures and all. So wherever the suture lines are there, on that layer if you cut or put a plane, on the coronal suture line if you put a plane, that is called as coronal plane. And if you put it on the midline, that is your sagittal suture line, that is your sagittal plane. Midline is little different. Sagittal plane is relation to sagittal suture. Wherever sagittal sutures are there, same way the plane is divided into left and right halves. One by one, we'll come back. So these are the various planes. Just now I told you sagittal suture. So median plane and the sagittal plane more or alike, they are together same only. We should divide the body into the midlines. So left and right halves will be there. Right? The coronal plane is also there. So what are these median planes? The median plane versus sagittal plane. More or less, they are almost the same. Median plane is an imaginary vertical plane. Median plane is an imaginary vertical plane which goes towards the midline of your body and divides the body into left and the right halves. It goes something like this. It divides the body into left half and the right half, both the sides. And it passes longitudinally. The median plane intersects the surface of the front and the back also. So anterior and posterior medial planes are also there. So these are your planes, median planes. So these are the various planes. On the coronal suture, if you put a plane, that is a coronal suture, so coronal plane. Sagittal suture, sagittal plane. And horizontal plane is called transverse plane. So this basics are only enough. You don't have to go into so much details of it. With this basics, when you read your regular anatomy, it becomes very easy. Next is your horizontal planes. Horizontal planes. Okay. So the term horizontal plane refers to a plane which are at right angles to both the median plane and the coronal plane. So it is the median plane goes like this, coronal plane comes like this, straight, like coronal plane comes like this. So this is horizontal to them. So this is what you are seeing is horizontal. It separates the body into upper part and the lower part. You can see this like an aeroplane, they have shown it. So this is your transverse plane. Full twist is there. Transverse plane, and it divides the upper part and the lower part, or superior part and inferior part. So this is often termed as axial plane also. Okay, so in the radiographs, layer by layer, layer by layer. If you take an apple and cut into layer by layer, so this is in one axial you are cutting. So in CBCT and all, we use this axial plane to identify defects and all. Next is your flexon and extension. Now see, this is my hand. Whenever I am folding the hand and bringing and bend it and it carries the limb anteriorly, it is called flexon. And extension, when I am putting it forward and it is becoming what is, it straightens the hand. Whenever it bends, it is called flexon, and whenever it straightens, it is called extension. Say very simple. The same photograph I am telling. So you see here, it is your hand is straightened. Right? It carries the limb posteriorly. Your hand is going backward and posteriorly, and it is like straightened. So this is called extension. And when you bend it, it is called your flexon. So now see this, Messi is playing football here. So here you see this leg is bending, so that is in flexon, and the other leg is an extension. Just for a reference, I gave you, right? It is not actually he's not standing in a axial plane, he's leaning also. So do not go into details of that. Just to make you understand, I gave this photograph. Next is abduction and adduction. Now see, whenever there is a reference plane, whenever structures are coming towards, it is adding up, coming towards the midline, it is called adduction. Coming towards the midline is called adduction. And whenever any structure is going outwards, laterally, is called abduction. AB, abduction. Now, abduction is an English word. You see that in a lot of movie serials and all crime killers, you will see that the actual meaning of abduction means kidnapping. So when you kidnap, what happens? The person or that particular human being is taken away. That is why, and kept in a different location. That is called kidnapping. So that is called abduction, going away laterally. But whenever it is coming towards, it is called as adduction. Okay. So those were some of the planes, anatomical terms and planes, what we have studied. So now let's discuss about your blood supply. So blood supply, this is very, very important. These are the basics. You will definitely next 5-10 minutes pay attention. You will understand the complete blood supply of head and neck. So now you see in your anatomy, you will have arteries, nerves, veins, and capillaries also. Arteries are red in color, right? Veins are blue in color. Nerves are yellow in color, right? So this is given for your differentiation also. And arteries, they carry oxygenated blood, so that is why red in color. Veins carry impure blood, so blue in color. And nerve supply is from the cranium, so cranium nerves. Now, see what is there in the screen. So it's a river map of India. So this river, it goes across India. So many, every state has different rivers, and this rivers will is required for a city to develop, for the agriculture land. So this is the source of life. It's a river of life actually. It's not the river; it is the river of life. Similarly, in our body, we have different organs. So they also need blood supply. So this blood supply is traveled in a river called artery. So what is artery? Artery is like a river. Artery is like a river. Now see, your house is there. You want water. So do you directly take water from the river? Definitely not. So from the river, the water will be taken by the government officials in a water irrigation department. They will recycle it, they will purify it, they will add chlorine and all, and then it comes as a connection. Similarly, in our body, arteries is passing through from an organ. It's from the structures it will be passing, and the blood will be taken from that, and impure blood will be given to veins. Okay, so these are our blood supply of our body. Okay, so we will be discussing this right now. So what is an artery? Artery, you can see the diagram, red in color. So it is a muscular tube. It is a muscular ball tube forming part of circulation system which carries oxygenated blood, and it is conveyed from the heart to different parts of the body. So from the heart, it is given to different parts of the body. That is artery. Similarly, veins will carry deoxygenated blood. So any of the tubes forming part of the blood circulation which carry oxygen depleted or deoxygenated blood goes towards the heart. Heart is the pumping organ or the cleaning organ, you can call it. We'll be discussing that. Now you see this photograph first. So you have got in one side you have got an artery, another side you have got veins. So from the artery, the blood will go into capillaries. Please understand very carefully. From the arteries, the blood will go and it will go into capillaries. From the capillaries, the blood will go to tissues. Oxygen will be given and the carbon dioxide will be taken. Who will take? Capillaries will take. Then this capillary will pass the deoxygenated blood into venules, and through the veins it goes to the heart again. So where in the heart? It goes to the right atrium, the cardiac cycle of physiology it is now. So you see here, what are capillaries now? So capillaries are the connection between arteries and veins. You can see here, it's like a brush-like structure or completely interlooped structure. So your red one are arteries, blue one are veins, and it is a completely fusion between them are capillaries. Now see this. So now, for example, from the heart the blood has gone and it went to any organ you take it. It went through the blood vessels, it went to the suppose parotid gland. And the parotid gland through capillaries, blood is given to the parotid gland, it is applied, and then impure blood is taken and it goes through the veins. And then what happens? This is your heart. So heart has got 4 chambers. So it is always opposite, okay, opposite. The photograph is the same opposite, right? So right atrium, right ventricle. Left atrium, left ventricle. So please understand that we always cross. So your impure blood, which has come from the veins, deoxygenated blood, it will go to superior vena cava. So from the superior vena cava, vena means veins. So from the superior vena cava, it will come to the first quadrant. Let us name it 1, 2, 3, 4. For our understanding, right atrium is first quadrant, left atrium is second quadrant, left ventricle is third quadrant, and right ventricle is fourth quadrant. That's for our understanding. So the impure blood, deoxygenated blood, will come through superior vena cava into right atrium. From the right atrium, the blood will go into the right ventricle through walls, semilunar walls and AV walls. That is the physiology part. Now, from the right ventricle, the blood will go to lungs. The blood will go to lungs through pulmonary artery. Right. So it is deoxygenated blood. So this is an exception. Pulmonary artery carries deoxygenated blood and it will go to lungs. It came to quadrant 1. From quadrant 1, it came to quadrant 4. And then from there, it goes to lungs for purification. So the impure blood will go to lungs and then it gets oxygenated. And then again through pulmonary veins, an exception, it comes to the second quadrant. Second quadrant, right? Upper part is second quadrant. To pulmonary veins, it comes to second quadrant. Now see what happened. First quadrant to fourth quadrant, impure blood, blue in color. Then it goes to pulmonary artery to lungs, again impure blood. And now the conversion takes place and the pulmonary veins will carry the oxygenated blood to second quadrant. In second quadrant, it will go to third quadrant, to the aortic, and then from there, arch of aorta, aortic valves will open. And from here, it goes to different parts of the body. So I hope you understood how from the artery, the blood goes to capillaries, from capillaries to veins, and again from the veins via heart, lung, it goes back to arteries. So now coming to nerve supply of head and neck. So, 1 second. Nerve supply of head and neck. Yeah. Now coming to arterial supply. So now this are aortic arch derivatives. We have got first arch, second arch, third, fourth, sixth arch derivatives are there. So which arch, what derivatives and what it will be supplied, this you will study in embryology in detail. I just gave it to have an idea. You should have an idea like this. So now we have studied through the cardiac cycle, through the arch of aorta, the blood is pumped to different parts of the body. Same thing. So from the arch of aorta, at the level of second intercostal cartilage, there are 3 branches. The 3 branches are your right brachiocephalic artery, left subclavian artery, left common carotid artery. So please understand there is 1 right and 2 left. And from the right brachiocephalic artery, you have got again 2 branches. You imagine that this is a daughter. Arch of aorta is the grandfather. It has got 3 kids. Right brachiocephalic artery is the daughter and 2 left, which are sons. The right brachiocephalic artery got married and again 2 kids. Right common carotid, right subclavian are the branches of right brachiocephalic artery. So the family name is right. Now from the right common carotid artery, again 2 branches. External carotid artery and internal carotid artery. So if someone asks you what is external carotid artery, It is a branch of right common carotid artery, right brachiocephalic, arch of aorta. Now this external carotid artery, it has again got so many branches. So it has got basically 8 branches. External carotid artery. You can learn it with a mnemonic. Some losers fail anatomy, other post magnificent scores. So this some losers fail are anterior branches. Some losers fail. And this is a mnemonic. So something starting with S, L, and F, these are anterior branches. Anatomy will go into the medial branch. Other post P, posterior branch. And magnificent score are the terminal branches. Imagine it is like a train. So this three, some losers fail are the engine, and magnificent score is the terminal, the guard book. So the branches are something like this. Some losers fail, so superior thyroid artery, lingual artery, facial artery. These three are anterior branches. Then your medial branch, ascending pharyngeal artery. Posterior branches, occipital and posterior auricular artery. And then your terminal branches, magnificent scope, maxillary and superficial temporal arteries. So in this, all of them, your facial artery is very important and maxillary artery is very important. That you should be knowing in detail. The same thing, your common carotid artery comes like this. It divides into external and internal. Please make a note, whichever is towards the face or nose, you can call it, that is your external, and which is backside is your internal. So before the bifurcation, there will be a hump, carotid sinus, carotid body. That you will study in the regular anatomy. Same thing, blood supply. So external common carotid artery divides into external and internal. External has got 8 branches. Right? See here, common carotid, external, which is towards the nose is external. Backside, posterior is the internal carotid artery. Now, so from the neck it's starting. You can see here it's starting from external carotid artery, takes origin from here. That is in the carotid triangle. So in the carotid triangle, see, external carotid artery has got 8 branches. This is the mnemonic what we have already discussed. This is the carotid triangle, what you will study in triangles of the neck. So please make a note of that. In the carotid triangle, external carotid artery, out of 8 branches, 5 branches will originate in the carotid triangle. What are those 5 branches out of 8? That is SALFO, SALFO. SALFO, SALFO. Superior thyroid artery, ascending pharyngeal artery, lingual artery, facial artery, occipital artery. So these 5 branches will supply, it will originate in the, in the carotid triangle. Now, facial artery and maxillary artery are important. So maxillary artery, again, major branches are infraorbital, posterior, superior, alveolar, inferior alveolar. These are 3 major ones, but they have got so many parts. So this maxillary artery, again, parts are there: first part, second part, third part. First part is called mandibular part. 5 branches comes from there. Second one is pterygoid part, 4 branches. And third one is pterygopalatine part, 6 branches coming from there. So these are the branches. From the first part, the branches mnemonic is Damai. B-A-M-A-I. B-A-M-A-I. So that is D for deep auricular artery, A for anterior tympanic, M for middle meningeal, and then I for your inferior alveolar. Then you have got your second part, which are basically related with your muscles of mastication and all. Right? So deep temporal artery, muscular branches are there. And then you have got the third part, which is called, the mnemonic is PIGPAS. P-I-G-P-A-S. P for posterior superior alveolar, I for infraorbital, G for greater palatine, S for sphenopalatine, and then it goes on. So please learn this branches, first part, second part, and third part. Now coming to facial artery. So facial artery, we have just discussed that it is a branch of, anterior branch of your external carotid artery. So it begins in the carotid triangle. So this facial artery, once it begins, it goes in front of masseter muscle. When you clench your teeth, you've got masseter muscle. Just in front of that, three fingers, if you keep it in the lower quarter of the mandible, you can palpate it here. So you can feel it here. So from here, it winds and it enters the face. And after entering the facial artery, that's why while giving incision, you should not be giving here. You should be little posterior, 1.2 to 1.5 to 2 centimeter. You have to give. That is called distance incision, which you study in final year. Because otherwise, facial artery will get cut over here. So here you will feel this. So that is also called as anesthetic artery. Then it goes towards the angle of the mouth. Then takes a turn 1.5 centimeter from the angle of the mouth. It will be here. Then it takes up and goes to on the lateral aspect of the nose and goes up and it fuses at the eye. From the eye, internal carotid artery branches will come, and here the external facial artery branches, they will anastomose in the eye. Like two different rivers meeting at a point. So that is your facial artery in brief. So facial artery has got course in the neck, that is called cervical course. Please understand, cervical means neck. So cervical means neck. So it has got cervical course where it has got 4 branches, right? And then in the neck, in the face, it has got 3 branches: lower labial, upper labial, lateral nasal. Then coming to internal, so external carotid artery has got 8 branches. You have to study facial artery and maxillary artery in detail. Similarly, internal carotid artery. This internal carotid artery has got 4 parts. The first one in the cervical part, that is in the neck, it has got no branches. Then in the petrous part, 2 branches: cardiotympanic, pterygoid. Cavernous part, it has got cavernous sinus over there. It supplies there. Then in cerebral part, it has got 5 branches, that is ophthalmic, anterior cerebral, middle cerebral, posterior communicating, anterior choroidal. Of all of them, ophthalmic artery is extremely important. Ophthalmic artery is extremely important. So this ophthalmic artery we will discuss. So whatever I am discussing today, if you learn this properly, your anatomy will be solved. Ophthalmic artery, first part. What is ophthalmic artery? Ophthalmic artery is the cerebral part of internal carotid artery. So then branches are arising from the retina, artery of the retina. Branches arising from the lacrimal artery. You have got 2 branches: zygomaticofacial, zygomaticotemporal, very important. Branches arising from the main trunk, that is supratrochlear and supraorbital arteries. These 2 are very important. Supratrochlear, supraorbital. In your scalp chapter, you will be reading this. Right. Then the nerve supply, which we have already discussed once, right, in our previous section. So still, I just give you a superficial view of the nerve supply. So nerve supply, we have got how many cranial nerves? 12 cranial nerves. Nerve supply of head and neck, we have got 12 cranial nerves. Olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, auditory, glossopharyngeal, vagus, spinal accessory, hypoglossal. It's not spinal accessory, it's cranial accessory. Okay. So how to learn in an order? So this is the mnemonic. O, 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 to touch and feel, A, Garam, Vada, Aha. So the first letters of each, you will find out this is the mnemonic. Now you see the first 3, olfactory, optic, oculomotor. All of 3 starts with O. Now please remember, when you go towards a factory, any factory is there, that smell will come. And from where do you smell? From the nose. Optic means eye, vision. That you know that. So how many nose you have and how many eyes you have? You have got 1 nose and 2 eyes. So 1 nose is for smell, and factory we have smell. So olfactory becomes 1. The first cranial nerve is olfactory. You have got 2 eyes. The second cranial nerve is optic. Automatically oculomotor becomes the third one. So out of this 12 cranial nerves, the most important one in first BDS, what you should know is the 5th trigeminal nerve. Very, very important. And then your facial nerve, 7th cranial nerve. You should, this 2 you should master it. So trigeminal nerve is the 5th cranial nerve. It has got 3 branches: ophthalmic, maxillary, mandibular. So which are the foramens through which it comes? So ophthalmic nerves, you can remember like standing room only. Standing room only. So ophthalmic nerve comes from standing, S. So S means superior orbital feature. room, foramen rotundum, maxillary nerve. Only foramen oval, foramen oval. So ophthalmic nerve comes from supraorbital fissure, maxillary nerve from foramen rotundum, and mandibular nerve from foramen ovale comes. Now ophthalmic nerve. It has got three branches. Never fall in love. Isoserially, frontal, lateral. The frontal nerve branches are supratrochlear nerve and supraorbital nerve. We have just discussed supraorbital and trochlear arteries, which are branch of internal carotid, ophthalmic and internal carotid artery. These are nerves. Names are similar, but there are no link between them. These are branches of ophthalmic nerve. Then maxillary nerve branches, again branches in the middle cranial fossa, in the pterygopalatine fossa, sphenopalatine nerve. These are the branches you should know. So if you write a notes for this and learn it, if this basics are clear, you can invest 2 or 3 days, take your time. Once this is there, done, then you read any chapter, you will know which is branch of what, and you will never confuse in anatomy. All the blood supply, nerve supply, everything will be solved. Then branches in the infraorbital groove and canal, you've got middle superior, anterior superior. Terminal branches of the face, inferior palpebral, lateral nasal, superior labial branches. So these are all branches of maxillary nerve, branch of trigeminal. Similarly, mandibular nerve. Mandibular nerve, again, it has got three major sub-branches from the main trunk, meningeal branch, and up to medial pterygoid. This is muscles of mastication. From the anterior trunk, sensory, and again, motor branches. So these names are there, you can learn it. And from the posterior trunk, auriculotemporal, lingual, inferior alveolar. This inferior alveolar nerve is the one which we block, anesthetize it, and extract the lower teeth, lower molars during extraction. We block inferior alveolar nerve. These are the branches of trigeminal nerve: ophthalmic, maxillary, mandibular. Coming to the seventh cranial nerve, very important, facial nerve. Again, it has got 3 to 4 parts. Within the facial canal, it has got 3 sub-branches. So someone is asking you, what is cauda tympani nerve? It is a branch of facial nerve which arises in the facial canal. As it exits from the stylomastoid foramen, you have got again posterior auricular, digastric, stylophylactery. When you hear at the very first time, it may look very complicated. Why so many branches and all? But when you write the notes and study, it is very, very easy. Very easy. Terminal branches on the face. 2 zebras bought my car. This is the mnemonic. 2 zebras bought my car. So 2 is temporal. Zebra is zygomatic. Bought is buccal. My is marginal mandibular. Car is cervical. And then communicating branches with adjacent cranial and spinal nerves. So we have discussed the blood supply of head and neck and the nerve supply. That is your all 12 cranial nerves. In that, 5th cranial nerve branches and 7th cranial nerve branches, we have discussed that. Right. So this is just a glance. Again, I'm giving you. So please learn this. It's very, very simple. Right. So then the venous drainage, right? So all those things we will discuss in our further sessions. So who are we? We are India's largest e-learning dental app, and we have got top instructors, and we have what we so from BDS to NEET MDS coaching is provided here, and it is all custom made and tailor made coaching we do provide. So this is our faculty team, right? All these faculties are picked across India, different subjects, pioneers in each of their subjects. So we have this video classes, the recorded classes are there. An app will be given, then you can download the app, and then you will get access to this classes. So these classes are there at your fingertip. Anatomy, physiology, biochemistry, BA, any class at whatever you want is just at your fingertip. All the classes are structured in a very simplified format, and topic by topic it is there. Along with that, MCQs are also there for NEET MBA students, right? It's a curated study materials. We do provide a beautiful, well-crafted study material also. So first year study materials are structured and curated. These are all QR integrated. So when you scan it, you can directly access more information on that. illustrations and flowcharts are there, and important past year questions are there. So this is the glimpse. The book is something like this, your notes, and then this is the photograph or the diagram taken directly from the notes. So in your book, this notes what will be given. Here you will be having all this kind of diagrams. Very simple, easy to draw and reproduce in the exams. Because in the textbooks you have diagrams which are all 3D animated. While looking it looks very good, beautiful, but you can't reproduce in the exam. So those things will be sorted out and all are ready to draw in the exams will there. So it's a structured notes throughout the year. You'll have a mentorship program also. So you have got live classes as well as recorded classes also. So you are having live classes like this, the way I am talking, there will be a live class structured by structure, but that is a separate entity. Recorded classes are at your fingertips, and these are the testimonials of some of our students who have studied and they got excellent marks. These are all our achievers who have passed their university exams with top marks. So students were struggling initially, and when they joined, a big transformation happened. So this is all at a very, very, what you say, a focused mentorship program is there throughout the year, so that you will have the best of coaching and the best of performance you can do that. So why choose Edentu? So each year syllabus is covered in less than 100 hours. So throughout the year you study. Suppose you don't go to college for a week, you have some ailment or you have gone out of station. So what you can do, always the classes are there on your fingertip. No matter wherever you are, you can always go to the classes. But whereas in the regular class, live class, if you don't go to college, the classes chapter is over. So here you have access to the class again and again. Night 2 o'clock also, you want to study physiology, one click and the teacher is there with you. Then curated study materials, question papers, question banks, personalized mentorship, and live discussion from the nation's best faculty are provided here. So these are our contact numbers. Kindly note these numbers. So this will be very helpful, and please pass on this information to all the needy people. So this is our QR code, right? So all the price, fees, and everything is there. So our number 9207444480. So these are our app, how to scan our app from the Play Store, from the Google Play, and from the App Stores also it's there. So BDS, MDS, both it is there. So you can take a screenshots of this and you can download our app. So in the app, you will have access for free classes. You will get access for free classes. Some classes are free. Okay. So some classes are free. So a question is there, after payment, what we should do? After payment, just contact the number, the same number you contact. First you contact this number, call that number and tell that you want to enroll, and then you can do the payments. So then you will be on mentor, our mentor will contact you and all the descriptions, everything will be given. And once you download the app, which is here, you have access for some of the classes which are open for everyone. You can go through it, you will learn so many things, and then you can enroll for a longer session. So we have got what you say, 3 months package, 6 months, and yearly also access at different things that our executives will, our mentors will tell you that. So the number is there. I again flash the number for your convenience. 9207444480. You can take a screenshot of this. This is extremely important number. Or you have our website is there, Edentu. You can go there and check our numbers. So this is the same number. It is there. So that's all in this session. So I hope the basics of anatomy, what is told today, it is actually the whole year's anatomy is given in a very simplified format. If you learn this, the blood supply and the nerve supply, what are branches, sub branches, and all, if you learn this and then you go to your first chapter of anatomy, I promise you, you will never be, or you will never have any confusions in the blood supply or nerve supply in any of the chapters in anatomy. Like this, there are hundreds of mnemonics, easy way of learning, right? So everything is decoded and in a very simplified format, it will be there. So that's all for today's session. Thank you. Yeah. So one question is there in the chat box. Can I start foundation course now? Yes, you can start. Please contact the same number. They will guide you. A new batch is going to start very soon. For the MDS, you can start. Please contact the same number what is flashed. They will guide you what to do next. Okay. So any queries, anything, please contact our executives. They will help you to guide.